Hi, everybody. Today I want to talk about COVID 19, do an update due to the news of the Delta variant and some additional studies that have become available, and some additional statistics and what we need to do about it. Okay, so the first thing is the R naught, R0 or R naught, which is a measure of how contagious a virus is. So, this Delta virus variant is far more contagious than the original Alpha variant that was circulating about a year ago. And it's almost as contagious as chickenpox. So, it's far, far easier to spread it, to catch it, and it can spread through the population far more rapidly than it could previously. And it was able to spread pretty fast then. So that's the first point. The second point I want to bring up is the results of a study done on an outbreak in Massachusetts. This town up in Massachusetts had several large events where they brought people in from all over the country to attend these events. Following that, there was a large outbreak of COVID 19. And in this outbreak, 90% of the cases were the Delta variant, and the majority of the cases, 74% of them, occurred in fully vaccinated people, people who had received the mRNA vaccines. That's either Pfizer or Moderna. So in this particular instance, the virus was able to spread easily among the vaccinated population. Now, they didn't get as sick. They were much less likely to be hospitalized, and no one died. But the point is that they were able to easily transmit it, and studies have now shown, and we now know that with the Delta variant, if a vaccinated person becomes infected, he can or she can spread it just as easily as an unvaccinated person. So the prior guidance that the CDC gave, based on the relatively low infectivity of an infected vaccinated person, no longer applies, because most of what we have in the United States now is Delta variant, and that does spread easily among everybody, including the vaccinated people. Some additional data, just to put things in perspective. Those who were vaccinated, however, were 25 times less likely to be hospitalized, and 25 times in general are 25 times less likely to die from an infection with COVID 19, and 8 times less likely to become ill if infected with COVID 19. So the vaccine still has a tremendous help and efficacy in those who receive it, but it doesn't do as well as it did previously. Another concern regarding this Delta virus is the Israel study that showed that the people who received the Pfizer vaccine, they found it was 64% effective in preventing symptomatic infection, which was much lower than the studies that we had in the United States, but that was before the Delta variant, the data that we had. But it still, even in Israel, was very effective in preventing hospitalizations severe disease and death. So, what do we do with this information? Well, for one, I think the data is constantly changing, and we have to keep looking at it and updating it because it's changing so rapidly. Two, I think it's time now for us to get booster vaccines. There's been a study showing that following 6 months, your immunity to the virus declines substantially, and this is especially a concern in people who are immunocompromised and those who are older, like 60 years or older of age. And my concern here is that while the CDC is waiting to collect all this data, those of us who got the vaccine back in December and January and are 6, 7, 8 months out from having received the vaccine have our immunity already declining, and we would like to get this booster sooner rather than later to maintain the level of immunity that the vaccine can achieve. And also, with regard to the vaccines, I think it's time for Pfizer and Moderna to edit and revise their mRNA vaccines and update them and include the current strains that are going around. It would seem, at least theoretically, true that if the Delta variant, for example, were included in the vaccine and we got a booster of a vaccine which included the Delta variant strain, then Delta variant wouldn't, be able to get around the vaccine so easily. And that's not just Delta variant, that's any of the new strains that are presenting a problem, and where the vaccine shows that it's not as effective as the original one. So yes, we should be updating these vaccines like we do every year with flu vaccine. That should be done sooner rather than later. The other thing that we need to do is, since we can't depend on the vaccines to prevent the spread anymore because the vaccinated are spreading it too, we're going to have to go back to doing mitigation measures to prevent its spread, which is masking, distancing, etc., and the other measures we do normally to prevent the spread of viruses. Whether you like it or don't like it, that's what's happening. That's what we need to do. I hope you found the information useful, even if it's not what you wanted to hear, and thanks for watching.